everyone.
Good morning, everyone.
Good morning.
Hi, welcome. Thank you all for joining Public Health Solutions, SCN,
Good morning, all.
HRSN Stakeholder Work Group. We'll get started shortly. Good morning, everyone. Thank you for joining. We'll get started shortly. Just let everyone into the meeting.
Is this Educating Our Families on yet? Not yet? Alright, we can always flip the agenda. We'll just wait another 2 minutes. Happy New Year to everybody. I hope everybody's doing well, staying warm. Rusty in the new year. If you could all please put your names and your organizations in there, and we can start in just a minute, and we'll flip the agenda, and then flip it back as everyone joins us.
Good morning, everyone. Thank you so much for joining Public Health Solutions, SCN, HRSN Stakeholder Work Group. I think we will go ahead and get started. I will turn it over to Allison Clark.
Good morning. Thank you so much for joining. We have quite a crowd today, so thanks all for logging on. We also have a pretty packed agenda. My name is Allison Clark, and I'm the Senior Director for the whole UNYC SCN here at Public Health Solutions. And for today's presentation, I'm joined by several of my colleagues, and I'll hand it over to Ralitza to introduce herself.
Hi, everyone. Great to see many familiar faces. My name is Ralitza Kona-Kalfas, and I am the Deputy Director for Public Health Solutions, whole UNYC SCN. We are excited to speak with you all today and wanted to note that we will be recording this meeting to share for any of your colleagues who are not able to attend, and the slides will be shared after the meeting. We ask that you please include all of your questions in the Q&A box that you'll see at the bottom of your panel. This will help us ensure that your questions are answered and not lost in the chat. And as Allison mentioned, we have a very packed agenda. So we're starting with some welcome and introductions, and I'll pass it over to maybe one of my other colleagues on the capacity building side.
Hi, everyone. Good morning. My name is Julia Keegan. I am she, her pronouns. I am the Director of Healthcare Community Partnerships Capacity Building, and I will be speaking to share a little bit more in the agenda about what we've learned from New York State regarding health homes and CMAs as it relates to the SCN.
Great, and I think we can go ahead and get started. So we will be giving a broad network update, looking at some of the timeline activities since our last work group meeting, key implementation milestones and discussing the upcoming launch. We will discuss the updates we have around capacity building funds, and then, as Julia mentioned, provide some guidance we have received from the state around health home and CMAs. We also have an appendix with additional resources for partners and guidance on data privacy and security. We'll pass it to Allison.
Thanks so much, Relitza. Since we last met as a group at the onboarding meeting, we have been busy on the PHS side with our activities toward leading up to 2025. We trained our internal teams in December. An updated fee schedule was released on December 18th, and we sent out our master services agreement in December as well. Starting on January 1st with the network launch, our own care coordination team has been busy pre-screening members and conducting outreach. Last week, we started provider trainings and we've had amazing attendance, so thank you all. Now that the enhanced services member file from our managed care organizations is available in our IT platform, we are screening members in Unite Us. This week, we are hosting both this meeting and an MCO stakeholder meeting with those managed care organizations who are our partners. We are actively reviewing submitted contracts, and we are fine-tuning our go-live planning for our first wave of providers to onboard this February 4th. If you have already submitted your Unite Us PRF form by the January 7th deadline, note that we are still actively receiving contracts and go live for available or doable for go live at 2/4. Key milestones for us as an SCN lead entity in major categories of our activities include governance and operations. We have hired key staff and we are building out our care coordination center. Our governance committee recently met, reviewed, and approved our spending plan. For our data and technology activities, we are working to make improvements to the user experience in our IT system, Unite Us. We have met several important IT requirements for Go Live, including approval of our data security requirements by the state. For partner engagement and contracting, we just yesterday released an open-ended RFA master services agreement. Contract execution is underway. In training and technical assistance and capacity building, we are very busy supporting all of the incoming inquiries we have from you all, as well as our partner ICOR completed their capabilities assessment report. We are currently delivering our January trainings, and note we are planning to release the February training plan soon, and it will go out to you shortly. We are setting up end users in our Unite Us system and working on our long-term data and IT workforce training plans.
A couple of points, Allison, if I may clarify. Hello, everyone.
Thanks, Zach. Yeah.
Tennessee. You could just go back one slide. You'll be hearing more about this later, but the spending plan that was approved by the governance committee was for the community-based organization capacity building funds, as well as for training and technical assistance. So this was a substantial part of our year one budget. And then on the open-ended RFA that was released, that is for community-based organizations interested in joining the network who may not have already joined in any of the previous RFAs that we released.
Okay, here we go. We now have information from members. This is an FAQ for members.
Thank you, Zach. And we will be speaking more to the capacity building funds application. But before we get there, I wanted to touch base around the network launch that is happening for Wave 2 partners. As we have discussed, this is an iterative process of having organizations join the network, and as we build it deeper and wider. And so we have a substantial number of providers who are joining within this, what we call Wave 2, which is going to be February 4th. While we have been communicating these priority dependencies, we wanted to touch base again as we are definitely in the middle still of training. So the first dependency is submission of the PRF, or the Partner Registration Form, by January 7th. As a reminder, the PRF is used for configuration in the Unite Us platform. Our trainings started as of January 13th, and the cycle will be completing January 31st. And I'll speak a little bit more about the minimum training requirements by role. As Allison mentioned, for these organizations who submitted their PRF by January 7th, we are still accepting MSA attachments B and I through January 27th. So if you have not submitted that yet, we encourage you to please submit so you are able to join the Wave 2 February 4th launch. You can submit that to your contract manager who originally sent out the MSA, and we'll have some follow-up information in later parts of the slide. We do need the MSAs to be fully executed by February 3rd, signed by both parties, for launch on the 4th. As I was speaking to, we do have minimum training requirements depending on the services that your organization is providing. Overall, we do hope that your users are attending all of these trainings as it makes sense per their role. But for the minimum training requirements, each organization must attend the SEN 101 training, as well as the lead administrators training that is taking place. Again, that lead admin training should be attended by an individual who is designated as a lead admin in the PRF. And if there are any questions on that, you can follow up with our team. Relatedly, for screeners, we have the requirement that they attend either the Unite Us SEN IT training for screeners and navigators, or the PHS SEN Care Delivery training for screeners. Again, we recommend attending both, and we will also be having all of these trainings taking place on an iterative basis, starting again in February. But for the minimum requirements, they need to attend at least one of those. For the navigators, it is similar, either the Unite Us SEN IT training for screeners and navigators, or the PHS SEN Care Delivery training for navigators. And finally, for service providers, they must attend the co-facilitated training with PHS and Unite Us for enhanced HRSN service providers. And again, this is going to be required on a per organization basis according to the services that your organization has designated they will be providing in your MSA. So if you have signed up to both screen and navigate, you would need to have all three of these trainings attended by your organization. Just pausing to check the chat. And so these are the requirements. We wanted to highlight this, particularly as we had trainings ongoing for the next week and a half. And we'll likely get to some Q&A as we move through.
I just want to go ahead and make one more reminder to all. With over 300 participants on this call, please put your questions into the Q&A section, not the chat section. So if you scroll down to the bottom of your screen, you'll see where there is a Q&A little logo there where you can put your questions in. Thank you so much.
Thank you, Mike. Appreciate that. And also, as a reminder, we will be sending out the training plan, the training schedule that you all should have received as a follow-up to today's call. So if you have any questions around where to find the links to register for any of the mentioned trainings, that will be provided as a follow-up to all of your organizations. Moving on, we definitely wanted to discuss the capacity building funds. As we mentioned, the spending plan was approved by our governance committee last Friday on the 17th. This spending plan was approved really by being informed from the I-Core capabilities assessment and report that you all contributed to in last year. We are excited to release the application shortly. It will be a form, and the application will be sent to organizations upon MSA execution. For organizations who have already had their MSA executed, you will be able to apply for the capacity building funds within 30 days of receiving the application itself. Moving forward, organizations will be able to apply within 30 days of MSA execution. So taking into account that some organizations have already been executed, so we'll not make that a shorter time for you all. We have some guidance that is additionally outlined in the form itself for the application, but wanted to review it today. In terms of the eligibility requirements to apply for the capacity building funds. One is that you must be a registered 501c3 or 501c4 nonprofit community-focused organization that provides HRSN services to Medicaid members. Your organization also needs to have applied through PHS's community-based organization RFA. And as mentioned, the MSA must be fully executed with the intent to provide some type of HRSN services for the network. Please note that per New York State guidance, health systems, local health departments, managed care organizations, and federally qualified health centers are not eligible to receive CBO capacity building funds, even if they meet the above eligibility requirements. As I mentioned, the I-Core capabilities assessment has been vital in this application process, and we will be sending this report to you along with the application form itself, so you can view what we are looking at, and also have a guidance around things like priority neighborhoods that have been highlighted in the report. Along with the I-Core capabilities assessment report, we will also be sharing a health-related social needs tool, which is a calculator to help inform organizational operating costs as you are filling out the application. This HRSN calculator will be an exercise to help your organization understand minimum staffing needs, service volume, and we will be having a webinar and additional resources to help your organization understand how to use this tool in February. And so you will receive, again, the I-Core report and HRSN calculator along with the application link itself. I will now pass it over to Julia, and one more reminder to please use the Q&A box at the bottom of your screen for any questions. Thank you.
Thanks, Relitza. With our hopefully full network to be on the call here, and with folks making decisions about contracting and workflows within their agencies with regard to the SCN, we know that folks have questions about how health homes and CMAs can best partner with the SCN. And so we wanted to take a moment to quickly share some of the information that was provided in New York State's recently released operations manual. that we're really excited to share is now public, and more to come on that. But we know that folks have a lot of questions about this and wanted to share some of those highlights. So, one of the questions that we've heard a lot from our health homes and our CMAs is about which services under on the SCN fee schedule they are able to bill for and be reimbursed for. Granted, they meet all of the requirements outlined by PHS and New York State for those services when providing those services to a health home member by a health home care manager. So, New York State has explicitly noted in the publicly available version of the operations manual for the SCN that HRSN screening, enhanced care management, and enhanced HRSN services, including nutrition, housing, and transportation services, are a payment point that health homes and CMAs are able to bill the SCN for and be reimbursed for, assuming they meet all the appropriate requirements. The service on the fee schedule that is not billable to the SCN for health home care managers providing services to health home members is the basic navigation. So, navigation to existing federal, state, or local resources. There are a couple of key points as well in terms of how services can be provided and documented between the health home program and the social care network, and those are highlighted in the two tables that are listed on the slide here. And so some of the key points that are explicit in New York State's guidance is that services for each program need to be documented in the appropriate platform. For the health home program, that's the health home electronic health record. So for example, in Foothold, and for any of the services being provided through the social care network that are to be reimbursed through the SCN under the fee schedule are to be documented in the SCN's IT platform. For us at PHS, that's Unite Us, as I'm sure you all know. And they're also, with regard to the specific plans of care, the health home program has its health home plan of care, as those of you who are health homes and CMAs well know. As part of enhanced care management, that level 2 care navigation care management for the social care network, there is a requirement to develop a social care plan, which is to be documented in the SCN IT platform Unite Us. So to make clear that there are those two plans of care that are distinct from the health home program and the social care network. Those are the main highlights that came from New York State's manual. I want to acknowledge that PHS is partnering very closely with the Health Home Coalition, with other lead SCNs, and with New York State to get additional guidance to answer some more of the specific questions that folks have about how to operationalize this guidance. We realize there are still some outstanding questions around how to operationalize the services that are billable and reimbursable to the SCN and to ensure compliance with all health home and SCN requirements in doing so. So we are working with that coalition to get more answers. I know folks on the call have been in touch with their lead health homes, folks from New York State. The one question we want to ask at this point of view, which I would love if folks could put into the chat, and we will take into our strategy discussions regarding health homes and CMAs, is what type of support would be most helpful to your organization to ensure successful integration of SCN and health home services. If there's specific information that you feel is necessary for your contracting, planning, and workflow development, if there are avenues or venues that you'd like to be hearing more information about developments related to how health homes and CMAs can align their work with the SCN, that would be really helpful. Again, as we continue those ongoing conversations with the Health Home Coalition, other folks in New York State's SCN space, and New York State Department of Health themselves. So I will leave it there, and Ralitza, I'll pass it back to you.
Great. Thank you, Julia. We will have a Q&A, but wanted to additionally ensure that we have some time to review the resources and guidance in the appendix. Starting off, As many of you all may know, the operations manual is now live for viewing on the Department of Health website. So we have linked that in this slide for your review and reference. For Unitas support, we want to flag that technical troubleshooting, particularly as it relates to the 2.4 launch, can be directed to support@unitas.com. There is also a chat feature in Unitas that you can get live support from staff. For the 2.4 launch, we will be sending more communication around the support for partners, but for any issues with overall configuration or organizational setup, this can go to our support whole UNYC SCN inbox. We will be monitoring and directing to the Unitas teams as relevant. And for the PHS points of contact, that is also the support whole UNYC SCN email, and I've included our contracting point of contact as well. You all should have individual contract managers who you can also communicate with, but if you have either don't know who that is or have broader questions, you can also contact Morelli Reyes, included here. I will pass it over now to my colleague Candace, and if you also want to introduce yourself.
Yeah, hi everyone. My name is Candace Cross. I use she, her pronouns, and I'm the training manager for Healthcare Community Partnerships Capacity Building Team here with PHS. So hopefully some of you are familiar with me from the trainings that have been conducted over the last couple of weeks. I just wanted to share a few updates about what's happening with training. I know there's a lot of questions in the Q&A. I've been trying feverishly to get back to folks. But we will have office hours every Wednesday through at 1:30 p.m. through February 5th. We intend to have an updated schedule for office hours for the rest of the month and ongoing. So that is why it's until February 5th. The training plan for February and Wave 3 is forthcoming, and we expect training to begin the week of February 10th. Attested trainings, here is the mandated reporter certificate. So in follow-up, if you haven't submitted that, that is a hyperlinked link where you can submit your certifications. And here are upcoming trainings for the rest of the month. As noted, required trainings for all SCN providers. Child abuse and neglect is required for social care navigators working with children, youth, and families. HIPAA is required for all SCN providers. Our next care delivery training for screeners will be on January 27th at 9:30 a.m. And there's the registration link in case you haven't attended. Additionally, our next care delivery training for navigators will be on January 22nd, which is today, and January 28th. And we are working to change the format of this training. I know that that has also been a concern. So with the next upcoming training dates, there will be a shift in the duration. And our next enhanced HRSN services training is January 24th and 30th. Thank you.
And a couple notes about some upcoming meetings as well. So we will have another convening like this for HRSN service providers next month on February 19th from 11 a.m. to 12 p.m. So same time, just in a month. The Zoom link is in the slides. A calendar invite was also sent out. So if you need that calendar invite, please feel free to reach out, but you may also use the Zoom link that's in the slides here. For our healthcare providers, those organizations who will be joining our network as healthcare providers, you would have heard from our capacity building team already, so you should know who you are. We are pleased to share that we'll be having a kickoff for our quality improvement work, our QILC kickoff on March 5th from 9:30 to 11 a.m. The registration link is forthcoming. Your contacts on the capacity building team will be sharing more information about that. But while we have you all here together, we wanted to just put a plug for that meeting where we'll be bringing together those of you who are joining our network as a healthcare provider.
Thank you, Julia. And the last piece of this appendix is some information and guidance around data privacy and security for organizations who are using Unite Us, particularly around exporting. Essentially, to best comply with the OHIP data privacy and security standards, we discouraged our partners from exporting and storing 1115 waiver data from any SCN platforms, including Unite Us and Hyphen, into your own systems. Once the waiver data is downloaded and stored, all data included in that system, as per OHIP, are held to the OHIP data privacy and security standards. This includes data pulled directly from Unite Us exports for any of the available reports and any 1115 waiver data that may interact with other data systems through interoperability. If a partner was to export raw data files from any of the supported IT platforms, they are expected to follow OHIP data privacy and security standards and are liable for any issues that may arise as a result of such data access and storage. Apologies for all the writing.
Can I add something really quick? Oh,
Yes,
maybe you
Zach.
can say it already, but one of the great achievements of the approval of our capacity building spending plan is the ability to provide cybersecurity insurance to any organization who may not have cybersecurity insurance but is interested in joining the network. And we are offering to support up to $1 million in cyber, the base level.
Thank you, Zach. That's helpful context within this guidance. And I think for additional information on, what this means for your organization, even though we discourage the use of exporting as the network partner, you will have access to dashboards via Unite Us Insights to monitor your organizational performance. And so these dashboards will provide an insight and overview into screening, navigation, HRSN service provision as applicable. And these will also be available to view at the staff level activity. And you will be able to receive monthly status reports beginning the quarter after onboarding with a summary of organizational activity to date and recommendations for performance improvement, if any. So that being said, we ask that each organization assigns one person to the org admin user role on the Unite Us platform, as this user role will have the ability to export data, even though it is discouraged to do so. And this user role is primarily assigned for maintaining the organization's profile up to date. So that'll be things like changing the description, capacity, service locations, hours, adding non-payment related users. And if there are any questions in this area, please contact either our team programmatically at the support email that we had included in the earlier slide, or our Senior Director for Quality and Evaluation, Daheli Rojas. Lovely. I know we have started answering a lot of questions in the Q&A. So please note, as our team has been answering those live, and there may be recurring questions in the inbox. Team, let's maybe highlight a few of the questions. I'm noting there are a number of people who have said they haven't received emails on trainings. Please share your email so we can ensure that you're on our distribution list. And as mentioned, the training schedule will be sent out as a follow-up to this call. I also noted there was a question about the fee schedule the updated fee schedule, and that will also be sent out as a follow-up to this call. I saw a question around capacity building funds for organizations that are providing only screening or navigation, but not enhanced HRSN services. Yes, organizations that are just providing screening or navigation are eligible to apply for the capacity building funds.
Can I add something here? So, and
Absolutely.
because I also noticed someone asked if it was available yet. We anticipate this week or next week, the form will be sent out to organizations who already have an executed MSA, for you to complete. It's a very simple form. It does not require an additional contracting process. There's an attachment in your current MSA that will be updated. And the vast majority of capacity building funds were allocated to what we call staffing advances, because that was what organizations told us they needed the most, with startup funding for staffing. And so there will be details in the form about what's included in a staffing advance. It is the personnel, but it's also the basic technology setup and associated OTPS with the personnel. And there will also be a section for individualized requests for organizations who have special needs based on the type of services that they're planning to provide.
Thank you, Zach. I also saw a question about training for staff, particularly as you have individuals who are still being hired or onboarded. Please note that if your organization is planning to launch within the 2-4 wave, your organization does need to meet those minimum training requirements. However, we will be starting training again with all of these same offerings in early February. So your team members who are not able to attend the trainings in January will be able to attend. Additionally, if you had members who attended trainings in January but feel like they want a refresher, want to have a bit of a better understanding, it is more than welcome to have individuals join a second training to have a greater understanding of the workflow. So I hope that answers that question.
Just another note about the spending plan that was approved. Included in there was also a learning management system. So we know in these early stages, it's a big burden to rearrange everybody's schedule and try to make as many folks available as possible for these trainings. But in the future, we will have a learning management system. So as new staff come on and staff leave, we will make learning modules available to the network to be accessed in an ongoing basis. So that was another item that was requested in the I-Corps capabilities assessment through your input and included in the spending plan.
Zach, I see another question that I think you may be able to answer. The ask was, can healthcare providers who are not eligible for capacity building funds have access to the HRSN calculator? Oh, Zach, you're on mute.
Yeah, no, I'm also thinking for a minute. Yes, I don't see why that should be a problem if by the HRSN calculator you're referring to like the tool we just acquired that allows you to input your anticipated volume of services and map it against your operational costs. Yeah, we have no issue with sending that to all folks who have started the process with us.
Thank you.
There's another there's another question related to the capacity building funds that also relates to health homes that I wanted to ask Zach if you might be able to weigh in on at this time. The question is providing enhanced SCN functions alongside Medicaid reimbursement services like health home services presents compliance risks. Would an internal quality function qualify for a capital funding request? Or if you could share where folks can find more information on what qualifies for a request or not, if that will be shared by PHS.
Yeah, so we think of systems, upgrades, specialized compliance, enhanced service, specific needs. If you're thinking about starting a medical respite or you need to purchase some type of equipment, outfit a space, obtain some external support on compliance that we cannot provide. Those all fit in the second category of requests, provided you qualify as a CBO and are eligible on the basis of what was already presented, then that would fit into the category of individualized requests, and you could document that request in the form that will be sent out.
Thanks, Zach. Liz, I'm happy to take a couple of the questions related to health homes and CMAs. I want to acknowledge there are a lot of questions about this, and I appreciate all of those of you who have put in the chat and the Q&A some of the areas where some additional support would be helpful. It's really helpful for us to know. One of the questions related to, gosh, all the questions are being pushed to the bottom. Give me 1 second. Sorry, I've lost it in the Q&A. Relitza, do you have anything top of mind just while I scroll back to?
Yes, there was a question on when an organization would be able to start providing services, screening, navigation, HRSN services. You can begin providing these as soon as your organization is set up for the SCN contracted services in the Unitas platform. So if you've submitted the PRF and have the MSA executed in time, according to what we discussed, that could be as early as 2/4.
I just want to distill the process to make it kind of simple for people to understand. There's basically 3 things that every organization must participate in to be ready to go live. And those 3 things are the PRF form, which allows you to be configured properly in the Unitas platform, the training requirements for the service types that you intend to provide, and the MSA execution process. So it's just like, it's those 3 things that are required before you can go live. And these initial waves have different timelines because the configuration process has been very manual on for our platform in the early stages, but they won't be so separated out. These waves won't be so separated out in the future. But 3 things.
Thank you, Zach.
Is there anything else, Relitza, you want to answer or can answer about the capacity building funding request, just so we can keep that stream of thought before I turn over to the health home and CMA related questions, which I now have available, but you tell me.
Thank you. I also am getting all these questions and trying to find the one I had just been looking at. There was a question about asking what the capacity building application form looks like. It is a pretty straightforward application. As mentioned, we are in the process of still finalizing to send out to organizations. It is pretty straightforward. I don't know the number of questions off the top of my head, but I would say less than 20 staff.
Yeah,
I don't know if.
and maybe I'll just it's very simple. I mean, we ask some basic information about your organization, of course, request their contact information, and then, based on your request, whether it's staffing or other, some additional information around kind of a justification summary to better understand your intended use for these funds. For staffing requests, we are asking for some FTE related numbers to get a sense of how many FTEs will this staffing requests support, as well as insight into anticipated funds usage completion. And maybe, and then overall, just some insight into potential prioritization in the event that we are unable to accommodate your entire request. But as Relitza and Zach mentioned, it's very simple, a few questions and then some overall information so that we can follow up appropriately and accordingly with the individual that's submitting the request.
Thank you, Keisha.
For those who have been with us this whole time, we know that we've been really focused on rapidly trying to stand up.
Julia, you can go ahead and speak to some of the health home and CMA questions as I keep checking the Q&A.
Thanks, Relitza. I will do my best to answer these questions to the best of our knowledge. As I mentioned, we're still working with a group of folks to try to get clear answers for those of you who work in health home programming. There's one question here that is asking, just for clarity, the lead health home can provide HRSN care management, not just the CMA. Some lead health homes are not direct service providers. So the answer to that question is that yes, both the lead health home and care management agencies can provide SCN services. New York State has said that any references in their operations manual to health homes refer to the health home organization in its entirety, including any subcontracted entities within the health home. If the health home staff get a referral from UniteUS for a screening, can we then bill for navigation as opposed to doing the screening and navigation on an existing health home member? If your organization meets all of the requirements, you're contracted with PHS, you meet all of our requirements to go live with service delivery, and you meet all the requirements for that navigation encounter that is provided in both New York State's operation manual and PHS's trainings on navigation, you would be able to provide navigation. It isn't a requirement that the screening and navigation be completed by the same organization or the same staff member, though FPHS will work with your organizations to ensure that connectivity and linkage for Medicaid members in our network is as seamless as possible, trying to minimize handoffs as much as we can. Will there be any tools to help agencies flag potential duplication or overlap from a data systems perspective in terms of health homes and SCN services? So one thing that is clear to us based on the guidance from New York State is that SCN services must be documented in the SCN IT platform. So when it comes to documentation, there is clear expectations in terms of health home services needing to be documented in the health home EHR and SCN services needing to be documented in the SCN IT platform, which is UniteUS for PHS. If you want to elaborate in terms of what type of tools would be helpful from our conversations with lead health homes and care management agencies, the concern is less around where data is documented in terms of when and how data is documented for service delivery through the health homes and SCN programs, and understanding what is billable based on what is covered in a specific encounter or conversation with a health home member. So that is part of what we are exploring with the Health Home Coalition with New York State to get more information and guidance to you all. I know there was a request for more specific scenarios. That is part of the work that we're currently doing to get more strategic guidance to your organizations on this topic. Can CMAs provide level 1 navigation, so the basic navigation to members who aren't enrolled in the Health Home program yet? This would include helping them enroll in Health Home and other services. If the individual is not currently a Health Home member, they would be able to receive basic navigation as long as they meet the requirements and eligibility for basic navigation. Again, that's covered. Those requirements are covered in New York State's operations manual as well as our navigation training. So I'll turn it back over to you if there's anything else, just while I scroll through and see if there are any other additional questions that I can weigh in on.
Thank you, Julia. And I want to ensure if there are anyone else on my team who wanted to answer some questions live, you have the opportunity.
That's a little less surprising, as we had mentioned before, is the prevalence of housing and nutrition needs. The two most common issues we know Medicaid members do face. And while this aligns with our expectations, it really does highlight the need that we're not.
I'm definitely seeing a lot of. Oh, go ahead, Allison.
I just noticed that there are a couple of questions that are on the theme around whether there's a maximum amount associated with capacity building. Do you want to take a chance to speak on that? That would answer several folks in the chat.
I can speak to it. The spending plan for year one is a total of $42 million in our budget that was approved to spend on CBO capacity building. We wanted to create enough funding for staffing that there were more FTEs available than the number of organizations in our network. That's not saying that every organization would have one FTE. We understand that some organizations might need more. But at the same time, we wanted to make sure there was sufficient funding within the parameters of the funding available through the grant. We came up with sort of a blended FTE rate that takes into account the cost of a single FTE plus supervision plus technology plus OTPS expenses associated. And you'll kind of be able to play with that in the tool that we are releasing. I think we're not expecting to, because the time frame of the overall waiver period and the need to become sustainable, we recommend folks try to think about a 9-month to sustainability plan when they're putting this together. So you wouldn't want to request a large workforce expansion that would be difficult to get to sustainability within 9 months. And I'll leave it at that. There's not hard and fast rules, but there's limits to what we can do with that amount of funding.
Thank you, Zach.
The other thing I would note is that folks should take a really close look at the I-Corps capabilities assessment. We will be prioritizing organizations that are able to provide services in multiple languages, outside business hours, in the neighborhoods identified in that assessment. And the state has asked us to prioritize small CBOs. They define that as 5 million or less in annual revenue. That's very small. We consider small to be a little bit bigger than that. But so we have been asked to prioritize small CBOs as well. So take those factors into consideration as you are applying for your funds.
I'm also seeing a few questions around determining member Medicaid eligibility and echoing a response that Rachel had put into the chat. That is included in the process of training for navigation and onboarding. The members' eligibility can be viewed within Unite Us and is also part of the workflow to check ePaces or MEVs to confirm their status, but that is covered in overall training. Julia, I see maybe one more related to health homes. I'm not sure if you could answer it. It says, can health home clients be switched to our organization in case the client prefers to get HRSN for language preference and more? Not to put you on the spot with that.
I'm just going to read it so I can make sure I answer to the best of my ability. I'm not sure I fully understand the question. I wonder, Sarah, if you can weigh in the chat or if you want to come off mute. When you say switch to our organization, what do you mean by that?
Thank you for your time. Actually, I do not know much about health homes and how it works, but it looks like a we both system might provide much very similar services, but let's say that we already there is one client having services from home, healthy home from any type of hospital or organization, but in case the client want to change their provider to KCS but because the client wants to prefer get a service in Korean language, for example, other their preferred language, but yeah, just wonders.
And so, you mean if they want to switch for health home services or for other services outside of the health home program?
Can we enroll them to our system?
I think this would be a question best answered about partnerships and relationships between KCS and health homes. I have your information. I can make sure someone on the team follows up with you. It might be a conversation that's more specific to KCS specifically. So I think it would be better to answer individually just to make sure we can answer your question as best as we can. We'll make sure somebody follows up with you. I do see another question here that I can weigh in on about health homes and care management agencies. So the question is, do I understand correctly that health homes and care management agencies can only screen and not navigate? So I'll start with that. It's a two-part question. I'll start with that first. So health homes and care management agencies may be reimbursed provided they meet all applicable requirements for that service for HRSN screening, enhanced care management, and any enhanced care services, so those nutrition, transportation, or housing services. The one service on the fee schedule that is not reimbursable for health home members being provided by a health home care manager or that health home or care management agency entity is basic navigation, so referral to existing local, state, or federal resources. Enhanced care management is a type of navigation. I encourage you to take a look at the fee schedule and the New York State's operations manual, which I believe was posted in the chat and in the Q&A, to look specifically at what each of those services include. Health homes and care management agencies will, through the health home program, navigate to existing federal, state, and local resources, which is why it's not reimbursable for the SCN. But the navigation to enhanced care services, which is that enhanced care management service, is reimbursable through the SCN. So there is a type of navigation that is reimbursable to health home and care management agencies for their health home members. It is only the navigation to enhanced care services and not the navigation to existing local, state, and federal resources. I encourage everybody who operates under the Health Homes program to take a look at the Health Home contracting section in New York State's operation manual. There is, I think, far more detail there than any of your organizations may have previously seen. So their question, the HRSN screening for adults is embedded in the annual comprehensive assessment tool for health homes. So how can they bill for screening? For billing and invoicing to PHS's SCN, those services must either be documented in the Unite Us platform, or if you are a healthcare provider, ingested through our qualified entity. This may be a conversation.
Julia, you're muted.
Yeah, sorry. A little more, thank you, Kim, a little more detailed conversation, but based on the way that our platform and billing and invoicing system is set up, that the completion of the AHC screening tool for health-related social needs screening would need to be documented in the SCNIT platform in Unite Us. Again, I know there's a lot of lingering questions here for health homes and care management agencies. I see the request in the chat for there to be a space for folks operating in that program to ask questions and get some more of these questions answered. So I'll leave it there for now. I know we're just a couple minutes over time, so Ralitza, I'll pass it over to you.
Wonderful. Thank you, Julia, and thank you all for sharing, staying on the call for a few minutes. As mentioned, we will be sharing these slides, recording, and the related resources in a follow-up email. Our team has been furiously copying all of the messages and additions to our distribution list from the chat and Q&A. So we will be following up as applicable. Thank you all so much for your collaboration in this work. We are really excited to get this SCN up and standing and have an impact within the community. Thank you all and have a wonderful rest of the day.
Thank you.
Thank you.